substance abuse. Remember, sobriety promulgates productivity. This message is brought to you by the Pharmaceutical Society of Nigeria, Rivers State Chapter, Committee for Drug and Substance Abuse Reduction. Thank you.
I love this radio station. Keep listening to Super FM.
Tired of the lies? Tired of the spin? Are you ready to hear the hard-hitting truth in a comprehensive, conservative, and principled fashion? Point Blank on Super FM 93.3 brings you all the news you need to know. Real conversations, real news, and one-on-one interviews with some of the most intriguing names in River State, South Nigeria, and the country today. Unbiased analysis the way you wish still existed.
They're damaging the economy of the country. I'm not bothered about whether federal government is supporting us or not. Because if you cannot protect the lives of your people, then there's no governance.
From the news that dominates the headlines to the important topics below the fold, left, right, and center busts the opinion bubbles and echo chambers with genuine discussion and real talk.
Out of $500 million that President Goodluck Jonathan borrowed for Abuja, Kaduna. At the time I was speaking, we were paid over 100 and something million out of the $500 million.
Tune into Point Blank with Shegan Awolabi every Saturdays 8:15 a.m. on Super 93.3 FM. Point Blank, civilized yet provocative.
Hello and good morning to you. This is Super 93.3 FM Port Harcourt. It's a beautiful Saturday and another edition on Point Blank. Point Blank is a news and current affairs program airs on this station every Saturday. And every edition of Point Blank will bring you the real issues and we'll look deep into the issues, doing all the analysis of the issues and getting you connected onto the issues and also getting your perspective in all of our conversation. And of course, it is the real issue, and we bring those who matter into the studio discussing all of these issues. And these are current issues as they affect the society. And every Saturday, we dissect all of these issues, looking at all sides and all angles to the issues, some of them making news headline, and some of them already generating conversation and controversies all around the media space. And thank you so much for joining us once again on Point Blank this Saturday. Of course, don't forget, you can be part of our global audience and consume everything we do on Super 93.3 FM Port Harcourt. You can watch all of our conversation on Facebook. On Facebook, it is Super 93.3 FM. We're also live on Twitter. On Twitter, it is Super News PH on Twitter. You can join our conversation and discussions on Instagram. On Instagram, it is Super FM 93.3. And also, you can consume all of our broadcasts on YouTube. On YouTube, we are Super FM PH. While on TikTok, it is Super FM PH. Now, you can download our global app and listen to Super FM anywhere in the world. Simply go to your Google Play Store and download Super FM Global. That's our global app, and you can listen to all of our broadcasts on Super FM Port Harcourt and other sister stations of Super FM. Once again, greetings to you. Thank you so much for joining us. Now, on the show today, it's a two-segment. On the first segment, we'll be discussing something very, very critical. We'll be looking at the burden of illicit drug use. Now, the statistics are not very friendly at all. And according to the statistics, it shows that about 14.4%, that is about 14.3 million people in Nigeria between the ages of 15 to 64 abuse drugs. And this is a statistic provided by the United Nations Office on Drug and Crime on the 25th of October 2022. And recently, federal lawmakers of the House of Representatives asked President Ahmed Bola Tinubu to declare a state of emergency on drug abuse in Nigeria. And the request by the lawmaker came just as the United States government has assured the National Drug Law Enforcement Agency of more support and collaboration in order to enhance its capacity to fight substance abuse and illicit drug trafficking in Nigeria. Here in River State, the story is not a very pleasant one. NDLE has been making some inroads in fight against drug abuse here in River State. And we have stories of illicit laboratories being shut down. We have stories of suspects being arrested, including the recent story of a 65-year-old woman who was nabbed with heavy amount of substance. And the question this morning is, are we really winning the war against drug? How come there is huge proliferation of illicit substance in our society? And it is so scary to know that even some young pupils in secondary school are now hooked on this substance. What is the way forward? And that's going to be the first part of the show this morning. On the second leg of the show, I'm going to speak into, a very interesting guest, and they are of the Microfinance Bank Association. You recall that recently the Central Bank of Nigeria revoked the licenses of over 139 microfinance banks in Nigeria. And this is already affecting customers of Microfinance Bank. Of course, you know the Microfinance Bank is a very special organ that is helping small business owners and small savers, particularly in the grassroots, to ensure they sustain their businesses. But right now, many of these people are losing confidence in the Microfinance Bank, and there is huge jittery in that sector. Now, I'll be speaking to experts and members of that association, but that will be on the second leg of the show. But right now, are we really winning the war on drug? How come there is huge proliferation of substances, illicit substances, on the streets, in the rural communities, in River State, not only River State, everywhere in Nigeria? Now, have you heard of this particular word? It's a very strange word, and it's one I'm trying to grasp with. Methamphetamine, I think something like that, but they call it meat or eyes. In the local parlance, they call it mkpurumiri. I gather that it is very, very easy to produce and very commonly found and highly effective. And so many young people are already hooked on this. Now, we'll be looking at the fight against illicit drug, and this is coming ahead of the International Day Against Drug Abuse and Illicit Trafficking, which is on Monday, June 16, 2023. I have with me in the studio some prominent individuals who are very, very critical in this fight. In the studio is a deputy commander of narcotics of the Nigeria NDLEA, Nigeria Drug Law Enforcement Agency, River State Command, who is also the public relations officer of NDLEA River State Command of NDLEA. Emmanuel Ogbumgada is with us. Good morning, sir, and thank you for joining us.
Good morning, and I greet you all listeners.
And that was the public relations officer of the NDLEA in River State. Also in the studio with us is another very critical stakeholder in the fight against illegal drugs and illicit drugs in River State and Nigeria. He's the chairman, Pharmaceutucal Society of Nigeria, River State branch, and is a trained addiction counselor. Pharmacist ANELE Promise is joining us this morning. Good morning, sir.
Thank you for having me. Good morning, listeners.
Fantastic, and thank you so much, gentlemen. Now, don't forget, you can also be part of all of our conversation this morning as we begin to look at what we're doing and the achievements in the fight against illicit drug. And the studio lines will be thrown open for you to ask questions and also to join the conversation. But let me begin with the NDLEA, and that is the public relations of the Nigeria Drug Law Enforcement Agency, NDLEA, in River State. First, we must commend the work you are doing. As journalists, we've been following on some of your successes and some of the arrests you've made so far, and they are very, very significant. However, our concern is hinged on the fact that despite all of these arrests, despite some of the prosecution you're making, the act seems to be growing. Or is it a wrong perception by my part?
The world drug problem, it's very, very massive. It's a very serious issue, and it's not just a Nigerian problem. You know, drug abuse and trafficking is a very serious one all over the world, and so that is increasing in Nigeria. It does not mean that it's decreasing anywhere. It's the same everywhere, and that is as a result of a whole lot of things, including the upsurge in social media activities, because you discover that even some drug dealers tend to reach, their consumers, through social media, and that we discovered that just recently that, some try to sell their products, the illicit substances through, the social media, and then aside that, the economic situation too. Joblessness and all that makes so many people want to, look in that direction. Like those who want to make money from it, look in that direction. And so while they are trying to make money from it, of course, they have to make the substance available to the consumers. So that's responsible for increase in these activities. But that notwithstanding, we are fighting relentlessly to ensure that we continue to bring it down, despite what they are doing. And of course, we will win the war. We are winning.
Well, again, that's a very hopeful promise. But when we begin to look at the statistics, recently the House of Representatives called on President Bola Tinubu to declare an emergency on illicit drug abuse. And the figure shows that people of 15-year-old and below are now using this drug. Is it as a result of how cheap it is, or the availability, or is it a problem of the society?
All three factors combined together, it's responsible. One, availability. Before now, what people know is cocaine, heroin, and of course cannabis, which locally they call Indian hemp, even though the Indian government have kicked against the use of the word Indian hemp.
Yeah,
it's giving a negative connotation to their, but a lot of people have come to know that name. So we are not saying it to paint the Indian public bad or the Indian people, but it's just that that's what people recognize it, the name people recognize it easily. But it's marijuana or cannabis sativa. So these drugs are the ones people used to know before now. But because those ones are expensive, especially cocaine and heroin, the youths, because of experimentation, they tend to, because they want to try a lot of things, they begin to experiment. And then those who also want to make money with this, now go on to aid them in providing those substances, like the methamphetamine you mentioned, also called umburumiri or ice. It's something that is easily produced within a small space, and that's very unfortunate because it didn't start here. What we used to know in Nigeria is Indian hemp, cannabis sativa, is grown in some states here, but unfortunately, some foreigners, brought this in, Bolivians, and their cohorts, and started producing this in Nigeria and have taught Nigerians how to do that. So it's an issue, it's a big problem, and just like you said, the methamphetamine is more effective than heroin and cocaine. It's very serious and more destructive at the same time. So we will always encourage people to keep off from these things.
All right, before we come to that, because again, the methamphetamine or burumiri or meth or ice, but because I also gather that it's very, very rampant in the eastern part of the country, which is very close to us. Well, I don't know how correct that is, but we'll be talking a little bit about that. However, pharmacist ANELE promise. Another aspect I want us to look at, and I don't want to ask Emmanuel Obungada this question, is the fact that the federal lawmakers, while calling on President Ahmed Bola Tinubu, also urged the president to increase budgetary allocation to the NDLEA. Again, that shows we're not even showing seriousness to the fight. If we understand how much the issue of illicit drug addiction has permeated our society, has eaten deep into the structure of our society. Now, we're talking about young people 15 and below. Even some parents are hooked on drugs, some grandfather are hooked on drugs. So it affects all sectors. Why should we be talking about poor budgetary allocation at this point?
All right, thank you very much. We cannot overemphasize the dangers of drug abuse. And speaking in that direction means that a lot needs to be done to be able to cater for this challenge. And science has also shown that addiction is not a moral thing. It's a brain disease. So when you begin to look at disease, you're looking at the health facility. So, and currently you find out that the facilities that are needed to take care of these people are really not so common. So if you want to get it and complement the effort of NDLEA, it means that fundings must increase and the health facilities needs an attention. So that's why I think that it's very necessary that budgetary allocation, because if you talk about the issue of drug, you're talking of NDLEA and then the health. So these two must grow hand in hand in every aspect of support to be able to win this war.
But again, you've just said it is a war. And the NDLEA spokesperson also said, we must win the war. Of course, he is saying that we are winning the war and we will win the war. I don't expect him to say anything less because it's an official of government. But again, from what we see, recall that in 1989, when NDLEA was set up, the funding and supervision of NDLEA was directly from the presidency. But today, it's no longer the case. Even some state governments, they don't even understand the importance of why they should support an organ like NDLEA. And we know that for every criminal activity, when you have proliferation of crime, check beneath, there is drug abuse. So are we really serious as a people in this fight?
I think previously the understanding was different about the cause of drug abuse. Go out there in the society, people feel your parents hadn't trained you well and all that. But if the understanding and the recent research that has shown that it's a disease, a chronic brain disease. So that understanding is yet to settle down. People have not really embraced it. Let me just give you an example. Somebody just called me 2-3 days ago, a parent that had a child that is using a substance. Obviously, the experience is usually not so pleasant. So he was asking me, what facilities do you know that I can send my child to? So I was trying to contemplate. I was like, okay, let me look for a good one. He said, no, I don't want a good one. I want a one that he will really suffer. So for him, he didn't see that child as being sick. He's seeing it that this guy, you have failed me morally and otherwise. So that is the challenge. So you find out that we need to, that's why I will speak on it much later. That's why we are getting into this whole thing, to let people know that it's a brain disease. The understanding needs to change. So if that message is preached, which I know is beginning to go down, like I know there is a lot of effort going on now in the States to begin to look at for interventions and ways of creating the needed facilities and atmosphere to improve in attention given to these people, just because they are sick and not because they have moral issues and all that. So I believe that gap is because of the understanding of what addiction or drug abuse is all about.
You know, we would like to bring this down a bit because you see, the issue of drug affects every status, no matter the part of demography. You become maybe wealthy, the middle class, and even those in the rural area. It's a case ravaging the society, and we should see it as such. Recently, a prominent female gospel minister or an evangelist embarked on a sensitization, and in fact, she even put up an organization to create awareness against drugs. I don't want to mention her name, but she's a very popular one here in River State. And the reason she gave was that her father was hooked on drug. Her brothers was hooked on drug. She wasn't taking it seriously until she discovered that her son, and she's a very wealthy person. And again, you're talking about the morals and here the burden on the society itself to recognize that it is a disease. But how serious a disease is this?
Let me just rely on what you have just said to expatiate my facts. You find out that it's a brain disease that goes into the genetic level. I know we're a product of what the gene, all kinds of gene we carry. And that's why you find that in a family where there are people who do drugs, they are likely going to have more persons because the penetration or the level of this alteration gets to the gene. So I think that the awareness to let people know that addiction is not a moral thing needs to be embroidered. We need to throw more light on it because that's a challenge. I've had the privilege of being around this practice for over 6 years. What you commonly find is that I hardly had seen any parent who feels the child is sick. And if you understand, just like somebody who has a cardiovascular issue, you find out that the heart is compromised. So if there's anything you need to do is see how you can help that heart to function. So if we do well in letting people know that addiction is a chronic disease, what does it mean to be a chronic disease? You know, chronic diseases, you can only manage it. just like hypertension, diabetes, you can only manage it. That's why sometimes when you hear somebody say there's a cure for hypertension, you begin to wonder where that person is speaking from. You can only manage it. So being a chronic disease that affects the brain, it means that you can only manage it. And remember, there's one huge challenge in the management of addiction, which is relapse. Relapse can occur at any time. In fact, relapse can occur even when one is in treatment for like 5 years, 10 years. And that's the biggest challenge.
We'll talk more about that, and we'll be looking at how to deal with this particular issue. If you're just tuning in, you're listening to Point Blank coming to you from Super 93.3 FM Port Harcourt. Monday, June 26th is International Day Against Drug Abuse and Illicit Trafficking. It is always celebrated every year. But again, beyond the propaganda, beyond the rhetorics, and beyond the celebration, are we winning the war against illicit drug? Are we winning the war against drug abuse? And that's what we're asking today. How serious is the issue of drug abuse here in Nigeria, and particularly in Rivers State? And I have with me in the studio this morning ANELE Ogbungada. ANELE Ogbungada is the Public Relations Officer of the National Drug Law Enforcement Agency, NDLEA, Rivers State Command. He's also a Deputy Commander of the Narcotics, NDLEA. And we're asking him how much has NDLEA achieved, particularly in the fight against drug abuse in Rivers State. And also Pharmceutucal, ANELE Promise is the Chairman, Pharmaceutical Society of Nigeria. He is a trained addiction counselor. And he has just told us that addiction is a chronic disease that we must take as a disease. Again, don't forget, we'll be asking you to join the conversation, and you can join us on the line 070-5079-1021. Again, to join the conversation this morning, 070-5079-1021 or 081-174-31021. That is 081-174-31021, as well as 090-3984-8244. You can as well send us a short WhatsApp message. Perhaps you're on drugs. You find that you are addicted on drug, and just like the pharmacist has told us that it's nothing to worry about. It's a disease, and it has a disease that has a cure. You want to narrate your experience, or you need assistance, you can remain anonymous. Send us a short WhatsApp message to 090-5948-1021. A short WhatsApp message, 090-5948-1021. Now, you can tell us your story, or perhaps you have someone who is an addict, hooked on drug, illegal substance, and you need the way to go about it. Join this conversation this morning, or send us your comments. Remain anonymous and send us your comment. We'd like to hear from you. Gentlemen, I would just like to take about 3 calls, and before we go back to the conversation. Good morning, and thank you for joining us. This is Point Blank.
Yeah. Good morning. Good morning.
Good morning. What's your name and where you're calling from?
My name is Susan. I'm calling from Rema community.
Thank you so much for joining us.
I also greet the professionals in the studio. Well, my position, just like you mentioned, the problem of drug abuse in Rivers State has become an endemic. I am from a Rema community in Onega, and then I noticed within my environment that children are into this thing. And from the angle of the NDLEA, I want to also say that NDLEA has never done much, because I've watched NDLEA actions. I think that's more of the reactionary. Arrest people, detain them, later they are bailed out. How far has the NDLEA gone in working with social organizations like NGOs for sensitization from the primary, secondary school to the university? Because I discovered that as a PRO of, before, as a former PRO of the Parents Association, Students Association in the primary school and secondary school in the Rema community, we have been talking to children on how to not to get involved into drugs. And this has also made the situation to be like, even if they enter into cultism, this has also linked them to be doing all these things that are not necessary. Okay. And how far have you also organized the River State government to make sure that this campaign and awareness is being carried on? Some
All
of
right.
us are involved
Well,
in some
thank you so
local
much.
NGOs and all of that. Thank you very much.
Thank you so much. I appreciate that. Let's take another one. Good morning and thank you for joining us. This is Point Blank.
Hello, Shegun.
Good morning.
Good morning.
Yeah.
Shegun, the awareness of drug abuse in this part of the world is very, very, very low.
Very low.
Yes. The consciousness of our youth. Shegun, if you go deep down the grains and the roots and grains of Port Harcourt, you know that this thing has been so deeply to our youth, our young ones. And then the awareness is very, very, very low. Our parents also have a role to play. They are not playing those roles. Go to the universities, Shegun, you will shed tears. I so weep for this generation. The roles the NDLA are taking, to me, I know very well that the awareness is not just so common. They should go about, they should go to universities, polytechnics, primary schools and secondary schools to create more awareness to these children so that they will know the consequences of what drugs abuse is all about. Thank you.
Well, fantastic. Thank you so much. Let's just take this question because two of the questions are directed to NDLA. First, the first caller from Erima community is saying that, well, NDLA, according to him, as taking a new jack approach, you have to be more proactive rather than reactive. And he feels you're not doing so much, particularly in the rural community. How correct is that?
All right, first, Emmanuel Obumbada.
Okay, Emmanuel Obumbada. I correct that. Yeah.
All right, thank you. Now, the man from Erima community that said NDLA is not doing much is not very correct. It's not that we are, in fact, it's not very correct. We are indeed working and making arrests and at the same time sensitizing the public. But you know, the extent that you can do is a function of your capacity in terms of finance and logistics. Now, you have already said that NDLA need budgetary allocation.
That's what the House of Representatives
yes,
said.
according to the House of Reps.
Yeah.
And indeed, we do. We need it. Just like Pharm Promise said earlier that at the time the agency was formed, you know, the vision of those who formed the agency at that time, you know, is if along the line changed, you know, with some other people. At a point, they did not see it as a very serious issue until recently, you know. At that time, in between, you know, those ones feel that, it's just a matter of, you know, people trafficking in the substance, because as at that time, Nigeria was just a transit country, you know, because of the difficulty in moving these substances from South America to the US and UK, you know. And at that time, if you're going to these countries from Nigeria, you know, sometimes they don't, the moment they see your green pass, they say, oh, Nigeria, they don't do much checks and all that. And so those people bring these things in from Brazil and then move it to the US and UK easily, you know. But it got to a point when people were being arrested from Nigeria, you know. At those countries, they discovered that these drugs were now coming in from Nigeria more. And so they became very serious with people coming in from Nigeria. So it became tight at the border and the entry point to those countries. And so those quantity of drugs that had already come in, they started finding it difficult to send them to those countries. They started looking for buyers here in Nigeria. And so it became a problem. Before you know it, a lot of consumers, you know, and so that problem increased. You know, so that perception as at that time that it's not a serious issue, you know, and people didn't know that at that time underneath, the drug problem was permeating and entering, you know, everywhere until suddenly it blew up. And that's the problem with this drug problem. In your family, you have your children, you have everybody, and then you see each other, you live fine in the morning, hey, good morning, you eat your breakfast, and everybody will come back. If one of your children begin to abuse drugs, you will not know at the onset, you know, until later, when it has become a full-blown problem, it starts from habits and then translates to disease. It's a habit, it's simple. Is it not just to smoke? Is it not just to take it? And then that individual that has started abusing these drugs feels that, look, he has control over it. At any point in time he wants to stop, he will just stop.
But again, the caller, beg your pardon, the caller there is said he feels
I'm
that...
going there.
Yes.
I'm going there. So gradually it becomes a problem and then it becomes a full-blown disease. So this war, it's not just a war for NDLEA alone. Now, the caller said that NDLEA is not doing enough, sensitization is not enough. It is a collective war. NDLEA and the health sector cannot win the war. We are doing our own part. We need others. We need the NGOs. We need civil society organizations. We need everybody.
But how much have you opened your doors for them? Because he's talking about Erema community, for example, that even working with as much as even the Parent Teachers Association in schools.
Okay, just like I said, that fund is a problem.
True.
We discovered that when we go to some communities to request that they should gather their people in a town hall that want to give sensitization, they ask us what we are bringing. How much are we giving them? What food, what entertainment are we bringing to them? When you say, look, we don't have money for this, but organize, they say, no, you are a government agency. Government must have given you money for you to come to us for this. They tend to look at it as political rally, where they want to get what they want to get from us.
The importance of taking this fight deep down to the grassroots cannot be overemphasized, because recently the chairman of the National Drug Law Enforcement Agency, Buba Marwa, talked about the proliferation of laboratories. And even some of these laboratories are created in places you hardly could suspect. I remember this one that was found in Lekki, a huge hall.
Yeah.
And again, so working deep down, even with estate association, landlords association, this is quite important, don't you think so?
That's where I'm going. You see, right now, this morning, as we're here speaking, some of our officers are at New Haven Estate, Rumokrushi by Igweche Road, around that area, doing sensitization. The landlord association, they realize the importance of doing this. Invited the NDLEA, so we are open to every invitation. We go to schools, we go to, just like we're partnering with Pharmaceutical Society of Nigeria and the management of University of Port Harcourt, for this United Nations International Day Against Drug Abuse. We didn't even request from Pharmaceutical Society of Nigeria. They came to us and said, look, let us do this. And we were happy. We said, okay, we were thinking of doing this and then invite everybody. But now that they came to us, let us do this. And with the University of Port Harcourt involved, wow, very massive. So that's what we encourage everybody, every segment of the society, every NGO. The man that called from Erema, nothing stops you from coming to NDLEA, nothing at all. Nothing. So we're very open. We are doing our best to remove these substances from the society. But because it's like demand and supply. Now, if there is demand, there must be supply. So if there is no demand, there will not be supply. And so while we are removing supply, we expect that, we will also engage in demand reduction. And that's what we are doing.
Fantastic.
So that aspect, we want this man and every other person that means well for our society to come join us. Let us reduce demand. As we reduce demand, then we'll also reduce supply. And the problem will go down completely. It's a collective war. It's a collective war.
And how much are we willing to get more people to join in this collective war? And that's the big question. You're listening to Point Blank this Saturday. It's a very special edition, and it's an edition dedicated to look at how we are winning the war against psychotropic substances or illicit drug, whatever name you want to call it. Are we really winning the war? Is NDLEA doing so much? And again, partners. How can NDLEA get the trust of partners in fighting the issue of substance abuse here in River State and in Nigeria. It's a very critical issue, and the House of Representatives has called on President Bola Tinubu to declare emergency in the fight against drug. It is one that is permeating every sector of the society, be it the rich, the poor, and the middle class. It is right there, staring at us in the face. And I have with me in the studio this morning the spokesperson of NDLEA in River State, ENYI Ogbungbada, is with us. And also I have with us the chairman of the Pharmaceutical Society of Nigeria, River State, who is a trained addiction counselor, pharmacist ANELE Promise. Yeah. Let us begin to educate people. A lot of calls are coming in, and we will take all your calls and all your comments on the social media. As a parent, because you see, when I read the statistics, there's a particular story let me just try to tell you. There's a gentleman who lives in River State, a well-to-do gentleman, very prominent gentleman. But again, there's a particular sibling, a girl child, out of university, hardly goes out, stays in her room, and always quiet. Then there's a gentleman who visited a particular time and asked the man, "What's wrong with your daughter?" He said, "No, nothing. She only likes staying in her room." And eventually it was discovered that the girl was hooked on drugs. Yeah. But the question is, she neither goes out. How did she get it? We discovered that all this social media, and you ask people, you order for things, they will bring it in a cake, and the cake is well wrapped. How can parents begin to know? What are the telltales? What are the signs that I should look out for as a parent to know that, hey, something is going on?
All right, thank you very much. I'll just go straight to your question, because it's one of the factors that is making drug abuse to be like something that is going like a wildfire. Is that, for me, I call it poor parenting. These days, parents hardly pay the needed attention to their children. I like the slogan you always use before your news.
Every child is your child.
Exactly. So you find out that, like the child you just mentioned, if that parent or the people who live with her had paid adequate attention, you would have noticed that there's something different. I'll ask, how much does parents know their children in terms of their behavior, in terms of the association, in terms of what they do? So if you have a parent that pays adequate attention, you will know when the child is beginning to deviate. So the common sense you will see, or that can tell you that something is going wrong, is what you have just said. When you see a child begin to withdraw back from the family,
suddenly quiet,
something is wrong. Appearance too, is one of the things that can tell you. Performance in school is one of the things that can tell you. The kind of association the child keep is one of the things that can tell you.
But some of them don't even go out. In this particular case, I told you, she lives in a well-secure estate, a duplex. She hardly goes out. But yet the drug was coming in.
Yeah.
Because she has access to money. I mean, the parents rich.
Yeah. If for me, I blame it on the parents. If they have done what they are supposed to do very well, I give you an example.
So again, what should parents begin to do? Because that's the essence of this program.
Pay attention to your child. Understand your child. Know what your child is doing. Monitor your child. Ask the relevant questions. If a child that usually returns from school by 2 suddenly start coming later than 2, why did you come back late? If a child that dresses well begin suddenly, it's no longer so much interested in the way that he or she dress, why are you behaving this way? If you check the academic performance, if you check the attitude, if you check the character, if you begin to notice anything different, again, for you to notice anything different is that you know the basis before you can differentiate. So it means that parents must pay adequate attention, and once there's a deviation, and the classical signs are attitude, withdrawal, appearance, performance, when these begin to deviate from what it should be, then you need to ask the relevant question.
And the very big challenge we have, and I'm going to be speaking to the public relations officer of NDLEA River State here, ENYI Ogbungbada, is that this particular brand of drug, meth, ice, Mkpurumiri, is so cheap. I gather that even with 500 naira you can buy. This is really crazy.
Even less.
Even less.
Yeah, with 200
you can buy. And somebody was asking me a question. Say, Shegun, have you ever wondered why bulbs, outside bulbs are disappearing? I said, what do you mean by outside bulbs? I said, that's what they used to cook the thing. I said, how? You'll be telling us more about that, how easily available, and what we need to begin to do, even as watchdogs. You're listening to Point Blank, and we're speaking on the burden of illicit drug and drug abuse on us as a people and as a nation. And of course, the House of Representatives has said that this is an emergency and has called on President Bola Tinubu to declare emergency on illicit drug. According to statistics made available by United Nations, about 14 million people in Nigeria are already hooked on drug. How can we help them? Is there a solution? How can we begin to nip it in the bud? And as law enforcement agency, how much more can NDLEA do in this fight? It is Point Blank, and let's take your calls. Good morning.
Hello, good morning, and your guest in the studio.
Thank you for joining us.
My name is Ozon Leah. I'm calling from Woji.
Ozon Leah.
Yes,
Ozon Leah, thank you.
Woji.
Okay.
Please, my input here is that no matter any type of sensitization carried out by any NGO, it can never stop our young youth or the old men from taking hard drugs.
Wow, that's a very harsh comment.
That bothers me is that the NDLEA, they are not active in their work.
Okay.
They're not active in their job. Because the only way you can stop this menace now is to cut that supply. If you cut the supply, the demand will die automatically.
Okay.
In this river state, particularly in this Woji, you will have a hot spot where this drug are being sold. I mean, hot spot, a well-known zone, a supply zone that everybody knows, that even the police, the armies come there to buy. Why can't you go there? MJ, why can't you go there and arrest those people selling those drugs? Why did you take your eyes off them and start chasing around maybe the retailers? Go to the wholesalers and grab them, arrest them, get them. No amount of placard or amount of say no to drug abuse, it cannot stop it.
All right. Thank you so much,
If you pick up any cigarette packet, you will see smokers die, alive to die young. Yes, the people are smoking. So the NDLEA should wake up to the call and stop blaming any funding or whatsoever. Go and arrest the supplier. When you do this, all this will stop. Thank you.
Well, thank you so much. It's only here from watching. And by the way, if you have a story you want to tell us and you want to remain anonymous, maybe you are already on drug and you want to be off it, send us a short WhatsApp message on 09059481021. I would like to hear your story. Let's take this call. Good morning and thank you for joining us. This is Point Blank.
Good morning, Mr. Shogun.
Good morning.
Yes, my name is Francis. I'm calling you from Professor.
Francis, good morning.
Yes. Please, I just tuned in now and I heard about drugs. We talk about how the government sets drugs and all of that. Yes, it is quite good enough to ensure that our youth do not become a victim of drugs. But at the same time, that is not the paramount thing that we need to do. I discovered that taking of drugs, some people take drugs because they are oppressed. Some people do things abnormal because of the situation in the country. So there are better things for our government to do. Can they just try to put other things in place, let the economy thrive, and let some other things move well? You will see some young youth become engaged in a meaningful thing they have to do. You know that the man selling drugs in the street of PRA in the night at any time, he is doing that because he has no alternative. He has no other job to do.
Okay.
So he sees that as the only means of making money for himself. So, and a caller just said, stopping drugs, it not really mean you go to the street. Stop it at the higher level. People bring these drugs in kilograms. How do they pass into the country? How do they navigate all the borders that we block?
Fantastic. Thank you so much. I'm going to take one more call, and after that, we'll be looking at providing help for those who are already hooked on drugs. Because no matter how much we talk about it, it's a very critical issue in our society. But how can we help people? We'll be talking about that. Let's take this call first. Hello, good morning, and thank you for joining us.
Good morning.
Good morning.
My name is Desire, calling from Tantamadi.
Desire, good morning.
I want to thank you for bringing this program for us as the vast. because I will not talk about Nigeria. River State. Pastor Shegu, NDLA have never, there is no campaign, there is nothing. I know every other person has said the same thing. Now they are saying, partner with us. Which security are they giving to those that want to partner with them? Pastor Shegu, did you know that the Nigerian government gave amnesty to people who does not deserve amnesty, who kill, who destroy? And what makes them to destroy those things? It is the same these drugs that gave them the might for them to go that land. And the Nigerian government gave them amnesty and be paying them. Shegu, immediately they started paying those boys. They took over the society at large. Every other person wants to belong with them to make sure they are also recognized. That aside, Shegu, the kind of enforcement that we have on our street today, they drag these drugs with these boys. Shegu, my brother, they went as far as going into bombs, smoking with these boys. And you come back to tell us we should join force with you. Which security did we have when we don't security to tell you? Like in my place, let me finish. Like in my place, if you come now, do you know before?
Where is your place?
You see somebody within Transamadi, you see somebody smoking on the street. But today, they smoke even before your front. They don't even mind because they knew that the people that ought to come to arrest them, they are also members. So it is a very difficult thing. NDLA should bring out a program that can be able to secure those people they want to partner with them. And at the end of the day, this team just ends.
Well, thank you so much, Desire. Yes. Thank you so much. Well, again, let me come to the spokesperson of NDLA. We know that there are bad eggs in everywhere, even in the homes. But the critical assurance Emmanuel is asking here is that, is there anything within the policy of NDLA that protects whistleblowers?
Yeah. Let me first come straight to Desire from Transamadi. You know, it's completely untrue that those who go to arrest them, you know, do the same thing with them. And from NDLA angle, we don't encourage that. And we don't even allow it. NDLA have a standard operating procedure where we have a well-organized disciplinary system where if anybody is found involved in drug crime, you know, the person is treated like a criminal. The fact that you are aware of the consequences and everything and you go get yourself involved, you know, we have a very, very strict way of handling that. So our officers are discouraged from getting involved, and indeed, we don't, just like you said, there may be bad eggs. Yeah, I cannot deny that, the fact of bad egg, but I don't, it's very, very insignificant. Now, we protect whistleblowers, our informants. You know, the achievements we have recorded so far is as a result of collaboration between informants and our officers. Now, there are certain places we cannot go in because when they see you, they know the kind of people that are expected to come there. So how do we go into those places to make arrests? It is through informants, and our informants are protected. There is no record anywhere so far in Rivers State that our informant has been killed or maimed, you know, because people don't even know them. So we protect their identity completely, except if the informant goes out there to boast, because some want to boast to show that they are, you know, to boast and then they identify them, you know. But so far, we train our informants such that they will not do that. Now the issue of that no matter what we do, that it will never stop, it's not true. It's not true. If we all collectively join hands to do this, you know, first and foremost, the family is the primary is supposed to be the primary prevention expert. Just like Promise has said here. If every family, every parent, every sibling observe each other, they will be able to identify when somebody is beginning to get involved in drug abuse and then start to do something to prevent it. Now, for the aspect of removing supply, we are trying our best. When I started, I told you, you know, we can only function at the level of logistics and funding that we have. And that we are doing. Now we even go extra mile to sacrifice certain things in order to make this job, to achieve, results. But we cannot do it alone. We cannot do it alone. Those who are saying that NDLEA is not here, is not there, organize your people and see whether we will not come. We will always be there. And then for somebody to say in Woji that, how have you given us information? My number is always open. People call me. Now, if you're scared that if you give information to any NDLEA officer, come straight to the office, request to see the state commander or the PRO myself. And then when you come, we talk confidentially. I transfer the information to the strike force team or those who carry out this operation. They are experts. They know what to do.
I know that the chairman of NDLEA, General Mawa, has even talked about several initiatives in the fight against drug. But again, the level of collaboration with the Rivers State government is what I don't even know.
Okay.
And I want you to talk about that. How much are you collaborating with the government of Rivers State?
Now, we are very much involved with the state government. We have written to the government, we've written to them severally, and, they have given us their support. Now there is a new government in place. We have invited the governor to the World Drug Day event on Monday, So we expect that the governor will come, or at least will send a representative, So that's the starting point. The governor is the head of the government of Rivers State, and then we're in direct touch with him. So we believe that the governor will give us all necessary cooperation.
Now, the reason why I asked of this is because, you see, there are some facilities that are expected to be provided by NDLEA, and this is coming to the issue of rehabilitation now. Right. We also know that NDLEA alone cannot do it. A good example is what is happening in Lagos, where Lagos State government and even the United States are working together to put in place world-class rehabilitation facility. Can we have same replicate in River State? And again, how much of these rehabilitation centers do we even have to start with? Maybe I should allow pharmacists.
Sorry, before Farm Promise says something about it, the chairman of NDLEA, retired Brigadier General Muhammad Marwa, last year wrote to every state government to try to provide one rehabilitation center in each senatorial district. By so doing, it will be easy for those within the rural areas, those that cannot come to the NDLEA headquarters, to access treatment. Now, if that is provided, you will discover that, one, there will be more employment, and then there will be more training for the experts who are ready to work. Because if you have a facility, you need to train people, and then you need to employ more people. And then the victims will have opportunity to access this treatment easily, So for now, the Rivers State government have not taken any action in that direction. But I'm aware that there is a rehab center built at Iriebe, and so
it's not just having mortar and bricks laid together, but we're talking about a world-class. I mean, River State is very, very critical, though I don't have the statistics of River State, but it is huge. Given the number of arrests you've made in the last 6 months, it's huge in River State.
Let me also say that one of the efforts we are making is to also improve, the size and standard of our rehabilitation center. Here in Rivers State Command at the NDLEA headquarters, we have a makeshift rehab center that can only accommodate 27 maximum.
I'm aware of that because now, you see, we've been working with NDLEA. Because what we also notice is
we have a land space, 4 plots of land.
Okay.
And we have taken the pain to produce architectural drawings, of how a standard rehabilitation facility should be. And then we have also sent this plan to the River State government and LNG, NDDC, and all to come to our aid to build this rehab center. Now, we have progressed, close to the extent of starting the rehab center with the last government, before it ended, and we sure will continue. And the good thing is that the SSG who was helping us to push this thing through, it has been reappointed as the SSG, so to make it easier, for us to get this thing done. So we are not relenting. For those, who are saying that NDLA is doing nothing, it's because you will not be there to see the moves we are making. You'll not be there to see it, but we're making all these moves. And the issue of arresting these people at Woji and all those things, please bring this information.
Well, again, it's not about arrest. It is what they even become, because it is the correctional approach that we should put in place. Because what I have noticed in most time is when we have this arrest, many of them end up in police cells. Police cell is not the proper place to correct them. And at the end of the day, somebody will come, take the bail, and they're released again. Go back, and you have even those that have been handed over to NDLEA. The question is, what correctional method are we in place to ensure that they become a better citizen? I mean, the pharmacist just told us here that the issue of addiction is a disease, and it's a very chronic one. So they need help. So I'll come to you, pharmacist Aniele. How much of the facility do we have on ground? He has just mentioned just but a few.
Okay, to be sincere to you, when I have opportunity to speak again, or usually recently, I talk about the way forward. The problem can go on and on and on.
Yes.
So we need to begin to look at solution to this problem. And for me, it's two-legged approach. We need to build facilities. We need to develop human capital for it. Because these are the gaps that we need to bridge to be able to begin to head to the right direction. Currently, you find out that facilities are some of the challenges. Yeah, there are some private facilities in the States, and I also know that there are some churches like Redeem have a facility, and NDLA also have. But like you said, when you look at rehab, there is a standard that enables people to get on with life, because these people are sick. And you look at it also, for when you're looking at addiction properly, yeah, sometimes mental issues can coexist, but largely sometimes there are no mental issues with this person. So they are normal persons. So in terms of facility, is a problem. And although I know recently...
What about what about the experts? Because again, putting on facility, do we really have experts that can provide these services that can help those who are already addicted?
That's where I'm going to. For me, I had the privilege of being sponsored by my facility. I work at River State University. 2 doctors were sent to Lagos, and we're all trained completely. And I think that is something that needs to be done, because that's the gap. Because rehabilitation is somewhat different from clinical issues. You find out that it's more of a social and a lot of different things put together to be able to bring people to that right place. So you find out that the right persons are not there. There are very few, and which is why there is need to train people, why facilities are built. And until we begin to look at what are the problems and then the solution, we can continue to talk and talk.
Fantastic.
And talk.
If you're just tuning into this program, you're listening to Point Blank Saturday, and we're looking at the burden of drug abuse. How these, of course, it's a fact that it has permeated the society, but what should we begin to do as a people, first to help ourselves, help our society, and help our country, Nigeria? Now, we just have about 5 minutes more on the show. In this remaining part of the show, we're just going to take very critical cases. Maybe you're already an addict and you need help. You can remain anonymous. Send us a voice note on this number, 090-5948-1021. Or you are a parent and you have a child or sibling or relative already addicted and you need solution. You can send us a voice note. We will only take voice notes or text messages. We will not take calls at this moment. We just have very few time, and we want to ensure that we provide solution. So again, all your calls and your text messages to 090-5948-1021. Send us a voice note. You can also send your comments on any of our platforms. We're on social media. We're on Facebook, Super FM 93.3, on Twitter, Super FM News PH, on Instagram, 93.3 Super FM, YouTube, Super FM PH. Now, let's just look at these comments that are coming in. And we have one here, no name. And this one is saying, greetings. Most of the drugs are addictive, hence the demand. What measures are in place to rehabilitate these users, disciplinary or mentally or medically? And this is from Major Port Harcourt. Major, looking at measures, and we'll also look at some of the WhatsApp. Another one is asking here, is hard drug a crime? Well, maybe the PRO of NDLE will answer that. Is art drug a crime? I have another one here. Good morning. I want to ask your guests, just trying to open this up now. Said, I want to ask your guests, where can one get rehabilitation center that admits ladies who are into drug, and can they recover, or can you recommend anyone? Let us start from that.
All right.
Rehabilitation center for ladies.
Okay, I know that at the Redeem camp, the rehab, both male and female, have been admitted and can get care there, and some private, even at the medical center, River State University, although that is a outpatient center, but services have been provided. And then there are some private facilities also in the state. And of course, I know NDLA has something. And what is beginning to happen at Irebe is also a center. So there are, but all the person needs to do is to reach out. And some of these things can be better explained if the person can call in.
All right. So again, this one is asking, is taking hard drug a crime?
Yes, it is. By virtue of NDLA Act, CAP N30, Laws of the Federation of Nigeria, 2004 as amended, taking hard drugs, trafficking, manufacturing, production, displaying for sale, it's a crime.
But some want to claim medical reasons.
Okay. Now,
Tramadol, some other syrups.
Where is the prescription?
Okay.
Yeah.
Well, the pharmacist is
Where
also
the
here.
prescription? Now, if one has a medical condition, there must be a prescription from a qualified medical expert, for you to use it. And even at that, if you have a specific prescription for the use of a particular drug, if you go beyond that prescription, it becomes drug abuse. Okay, so we have had cases of people who genuinely have prescription, and then after a while they go beyond that, and we have even had cases where when somebody gets his own prescription and another person has a problem that it's similar to the one that has prescription, you say, hey, what was that drug that doctor gave you? The person goes there to buy for himself.
And a very serious case is tramadol.
Yes, without going for medical examination.
Yeah.
It is a crime. It's drug abuse.
But you see, I'm going to come to the Pharmaceutical Society, and we just have 2 minutes to wrap all of this up. First, I am, some Nigerians are very excited at the House of Representatives throughout the bill on legalizing cannabis. But again, some people have claimed that there is a medical version of cannabis which they accuse NDLE of not even recognizing. Again, maybe I should ask and promise NDLE this first before I come to NDLEA.
All right, the truth, that is correct.
Yeah.
But the fact is that there's a thin line.
Yeah.
And because, these are called psychoactive substances, what do? They alter your mood, your reaction, your thoughts. And where did they affect? The reward center. This is the center that's responsible for good feeling. And basically what they do there is to increase the release of dopamine. So you may be taking it for pain, but because of this interaction with the reward center, which will lead you to wanting to have that experience again, from just trying to manage a disease condition, you can cross over to being addicted. So that's why even in that thought process, we need to be very careful.
Okay, so let me ask Emmanuel Bunga again. He has just told us the thin line, but do you arrest, I don't know, maybe that's the right question. Do you arrest people who are using medical cannabis? Or do you even recognize that?
Medical cannabis in Nigeria?
Yeah, some people get it. I've seen a lot of people come with it.
The issue is that a certain governor, sometime last year or year before last,
yes,
was canvassing that there is medical cannabis, we should not, and all
yeah,
that.
I'm aware of that story.
Yes, he made this advocacy to NDLEA, and the chairman, chief executive of NDLEA then, detailed some of our personnel, and then with the governor, he detailed some other people, and they went to do some research. By the time they came back, that matter died down. Why? Because they discovered that the medical cannabis, that in US and some other countries where they are used, the tetrahydrocannabinol, which is the most active ingredient, it's quite
Very low.
small, very, very low, about 0.02% or thereabout. Whereas that in Nigeria
is enough to hire you.
Cannabis is very, very high.
Oh my God.
It's very, very high. And so you cannot just use that because it is very addictive, and very destructive. So until we get to that level where we until we get to that level where we will remove or reduce the quantity of THC in cannabis, it will be very, very.
All right.
It's very, very bad.
I know the Pharmaceutical Society, they have a program on Monday, which is, I will just allow you 60 seconds to talk about it. But just before then, there's a gentleman who has sent us a message here on Anonymous. He said, "Good morning, sir. I do take tramadol when I want to do hard work because I was recommended that it helps a lot. Is there anything bad in it?" A short answer.
It could lead to addiction.
It could lead to addiction.
Yeah.
All right, fantastic. So let us talk about Monday. You have a big program, the Pharmaceutical Society of Nigeria on Monday. Yeah.
All right, thank you very much. As a way of lending support or joining in the fight of this whole menace, that's why we are collaborating with NDLEA. And what we have also thought to do is we had in 2018 as looking at the problem and then what do we do as a responsible society. We said, okay, with the understanding that addiction is a disease and not a moral disorder, then we need to join hands to reducing this problem. So we had a stakeholders roundtable conference where three-legged approach was designed. One, awareness to let people know that it's a disease and people need to stop the way they go about it. Two, provide linkage for those who have been affected. And then design measures that can prevent this from increasing. And that's what had led us to partnering with the institution, management of the institutions, to be able to, on campus, work out measures to reduce this. This we have done at Rivers State University in 2021. In 2022, we did it with Ignatius Ajuri University. In this year, we are doing that with the management of the University of Port Harcourt. Of course, all along with NDLEA. And what we intend to do is to create the needed awareness in that place, and then inaugurate a drug-free club, and then give a lending hand in partnership with NDLEA to the management to see how this whole fight can continue. Because we can talk about on and on and on and on, but for us is how do we begin to look for solution, and that's basically
key.
What
fantastic.
With NDLEA.
So as we round up, I'm going to ask the spokesperson of NDLEA in River State. Is there a number people can call? Because we have a lot of messages we've not gone through, and a lot of calls are still coming in. Can they reach you on a special line to talk to you about this issue?
All right, yes. First, I would like to just start from the program on Monday.
Yeah.
It's United Nations International Day Against Drug Abuse, and then the theme is People First. Stop stigma and discrimination, strengthen prevention. So the focus is around people.
The people.
Yeah.
Especially the victims of drug abuse. Yeah. Now, he has already said that drug abuse is a moral thing, but drug supply is a crime. Drug abuse is a sickness. It is a disease. Now we treat those who are addicted, as patients, but at the same time we treat those who are distributing these drugs
as criminals.
So it's a two-legged thing, and then we are in both fights. So we are, asking people to collaborate with us. Now, the chairman, chief executive officer of the agency, has made it easy for people to reach NDLEA. NDLEA has a toll-free line, toll-free, no charges, and it is language specific, meaning that you can speak in English, Pidgin, Igbo, Yoruba, Hausa, or any language that you wish to communicate. And then it is 24/7. In the midnight, at any time, if you call, there is somebody out there that will respond to you. And it's not just for the drug victims, even the family members, and then even those who want to give information to NDLEA, you may choose not to say your name. Just say what you want to say what the problem is, say the location and everything, and then NDLEA will come to your aid. This center is located at the national headquarters. So whichever state you're calling from, the national headquarters will activate that state command, and then they will take necessary action. Now, the number is 0800 10 20 30 40. 0800 10 20 30 40. Yeah, that's the number.
So again, you can get across to NDLEA on this number, 080 010 20 30 40. Yeah. It's toll free and you can speak on any language.
Yes. And then for River State Command, you can always reach me on 080 62 56 36 77. 080 62 56 36 77.
It's a pleasure talking to you this morning, the Public Relations Officer of NDLEA, National Drug Law Enforcement Agency, River State Command, Deputy Commander of Narcotics, Emmanuel Obumgbada. Thank you so much, sir, for coming to the studio. And also Chairman, Pharmaceutical Society of Nigeria, River State, Pharmacist ANELE Promise. Thank you so much.
Thank you.
It's been the first segment of Point Blank this Saturday. On the second segment of Point Blank,